Hello, lovely ladies and mamas to be. Pregnancy may be a magical journey, but let's be real. It's not all about glowing skin and the baby kicks. Today, we'll talk about a less glamorous but super common issue in pregnancy, which is constipation. Yep, if your digestion has slowed down to a snail's pace, you are not alone. Over 1 in 3 pregnant women develop severe constipation in the second or third trimesters. But don't worry, we have some gentle and safe tips to get things moving again. Hello all, Dr. Neha Garg here, a functional nephrologist and an Ayurvedic health counselor. Today, we will look at the causes of constipation in pregnancy and what you can do about it. We will also review the list of safe laxatives versus the unsafe ones. You can access this list in the description section below. So let's begin by reviewing why the system gets clogged up in pregnancy. First up is the hormonal changes. Elevated levels of progesterone in pregnancy, they relax the smooth muscles everywhere, including the intestines, which then slows down the bowel movements. Second is mechanical pressure. As the uterus enlarges, it exerts pressure on the intestines, particularly in the later stages of pregnancy. So during third trimester, this can become especially problematic. Last is the dietary factors, along with reduced physical activity. Iron supplements, which are often prescribed during pregnancy, are known to cause constipation. On top of that, pregnant ladies often reduce their water intake due to this frequent urge to urinate. So the interplay of all of these factors makes your bowels more sluggish as the pregnancy progresses. Now let's talk relief Ayurvedic style. For Ayurveda, constipation is a vata aggravation. And in order to cure vata disorders, the best step is eating warm cooked mushy foods like khichdi, barley soup, and stewed apples. Avoid cold beverages, cold smoothies, and dry foods like crackers, chips. Try to sip on warm water throughout the day. Many routinely used Ayurvedic herbs are unsafe in pregnancy and should be used only under supervision, not without. These include Triphala and aloe vera as well. Castor oil is strictly avoided during pregnancy as it can trigger uterine contractions. Some pregnancy-safe options are: number 1, ghee with warm water. 1 teaspoon of cow's ghee in warm milk at bedtime helps lubricate the intestines and it softens the stools. Next is soaked raisins or figs, which act as natural laxatives and are rich in fiber. You soak overnight and consume them in the morning. A spoon of psyllium husk or isabgol in warm water is a mild bulk-forming agent. And last is ajwain and fennel tea, which supports digestion and it reduces bloating. Next, over to the lab coats, and let's see what functional medicine has in its toolkit. First recommendation is to eat 25 grams of fiber daily from veggies, berries, chia seeds, flax seeds. You can also count psyllium husk in this fiber content. Next is load up on magnesium-rich foods like spinach and pumpkin seeds. Magnesium helps to draw out water into the intestines and it eases the passage of stools. You can also try magnesium citrate under your doctor's supervision. Omega-3 foods, they help to lubricate the intestines and support hormonal balance. These include fish, walnuts, chia seeds, fatty fish like salmon and mackerel. Next is probiotics like yogurt, buttermilk, and fermented veggies, and prebiotic foods like garlic, onion, and leeks to keep your gut bacteria happy. Watch out for old school iron tablets like ferrous sulfate. These are known constipators. You can ask your doctor about switching you to gentler forms like ferrous bisglycinate. Pregnancy-safe laxatives are stool bulking or stool softening agents like psyllium husk and magnesium citrate. Docusate or colase and lactulose are sometimes given, but these are not studied in large trials. Stimulant laxatives are to be avoided in pregnancy. These include senna or senocot, isacodil or dulcolax, castor oil, and aloe vera. Review the handout in the description below to get more details. Last comes gentle yoga practices to improve digestion, circulation, and the movement of intestines without straining the body. The cat-cow pose is helpful as it gets your spine and gut moving. The garland pose or the yogi squat is also helpful. It gently opens up your hips and aligns your colon to gravity. Use a chair for support. After meals, sit in Vajrasana or diamond pose for 10 minutes. It helps in aiding digestion and relieves bloating. And lastly, do not forget your breath. Try to practice Anulom Vilom for 10 to 15 minutes every morning on an empty stomach. This helps in reducing the Vata aggravation. It relieves anxiety and helps you with your overall health and well-being. Avoid deep twist or aggressive belly work. We have to keep it baby safe. Constipation in pregnancy is common, but you do not have to suffer in silence. Between Ayurveda, functional medicine, yoga, and smart modern choices, relief is just a few mindful steps away. If this video helped you, please help us by hitting the like button, share it with your mama tribe, and please subscribe for more holistic tips. Don't forget the free handout in the description section below. Till next time, stay healthy, stay well.